Antibiotic resistance. Key facts. Antibiotic resistance is one of the biggest threats to global health, food security and development today. Antibiotic resistance can affect anyone of any age in any country. Antibiotic resistance occurs naturally, but misuse of antibiotics in human and animal is accelerating the process. A growing number of infections, such as pneumonia, tuberculosis, gonorrhea, and salmonellosis, are becoming harder to treat as the antibiotics used to treat them become less effective. Antibiotic resistance leads to longer hospital stays, higher medical costs, and increases mortality. What I can say in this short, brief introduction: antibiotics are medicines used to prevent and treat bacterial infection. Antibiotic resistance occurs when bacteria change in response to the use of those medicines. Bacteria, not humans or animals, become antibiotic resistant. Thus, bacteria may infect humans and animals, and the infection they cause are harder to treat than those caused by non-resistant bacteria. Antibiotic resistance leads to the higher medical cost, prolonged hospital stay, and increased mortality. The world urgently needs to change the way it prescribes and uses antibiotics. Even if new medicines are developed, without behavior change, antibiotics resistance will remain a major threat. Behavior change must also include action to reduce the spread of infection through vaccination, hand washing, practicing safer sex, and good food hygiene. Scope of the problem varies. Antibiotic resistance is rising to dangerously high level in all parts of the world. New resistance mechanisms are emerging and spreading globally, threatening our ability to treat common infectious disease. A growing list of infections, such as pneumonia, tuberculosis, blood poisoning, gonorrhea, and foodborne disease, are becoming harder and sometimes impossible to treat as antibiotics become less effective. Where antibiotics can be bought for human or animal use without a prescription, the emergency and spread of resistance is made worse. Similarly, in countries without standard treatment guidelines, antibiotics are often overprescribed by health workers and veterinarians and overused by the public. Without urgent action, we are heading for a post-antibiotic era, in which common infection and minor injuries can once again kill. Prevention and control is needed. Antibiotic resistance is accelerated by the misuse and overuse of antibiotic, as well as poor infection prevention and control. Steps can be taken at all levels of society to reduce the impact and limit the spread of resistance. Individuals. To prevent and control the spread of antibiotics resistance, individuals can only use antibiotics when prescribed by a certified health profession. Never demand antibiotics if your health workers say you don't need them. Always follow the health workers' advice when using antibiotics. Never share or use leftover antibiotics. Prevent infection by regularly washing hands, preparing food hygienically, avoid close contact with sick people, practicing safe sex, and keeping vaccination up to date. Prepare food hygienically, following the World Health Organization key to safer food. Keep clean, separate raw and cook thoroughly, keep food at safe temperature, use safe water, and have materials and choose food that have been produced without the use of antibiotics for growth, promotion, or disease prevention in healthy animals. Policymaker. To prevent and control the spread and antibiotic resistance, policymakers can ensure a robust national action plan to take antibiotic resistance is in place. Improve surveillance and antibiotic resistant infection. Strengthen policies, programs and implementation on infection prevention and control measures. Regulate and promote the appropriate use and the disposal of quality medicine. Make information available on the impact of antibiotic resistance. Health professionals. To prevent and control the spread of antibiotics resistant, health profession can prevent infection by ensuring your hands, instrument and environment are clean. Only prescribe and dispense antibiotics when they are needed according to current guidelines. Report antibiotic resistant infection to surveillance teams. Talk to patient about how to take antibiotics correctly, antibiotic resistance, and the dangers of misuse. Talk to your patients about preventing infection, for example, vaccination, hand washing, safe sex, covering nose and mouth when sneezing, but also use natural products to improve your health, your immunity, etc. Healthcare industry to prevent and control the spread and antibiotic resistance. The health industry can invest in research and development of new antibiotics, vaccine, diagnostic, and other tools. If I speak about agriculture sector, to prevent and control the spread of antibiotic resistance, the agriculture sector can only give antibiotics to animals under veterinary supervision. not use antibiotics for growth promotion or to prevent disease in healthy animals, vaccinate animals to reduce the need for antibiotics and use alternative to antibiotics when available, promote and apply good practice at all steps of production and processing of foods from animal and plant source, improve biosecurity on farm, and prevent infection through improved hygienic and animal welfare. Recent developments. While there are some new antibiotics in development, none of them are expected to be effective against the most dangerous form of antibiotic-resistant bacteria. Given the easy and frequency with which people now travel, antibiotic resistance is a global problem, requiring efforts from all nations and many sectors in the world. Impact. When infection can no longer be treated by first-line antibiotics, more expensive medicines must be used, a longer duration of illness and treatment. Often in hospitals, increases health care costs as well as the economic burden on families and societies. Antibiotic resistance is putting the achievements of the modern medicine at risk. Organ transplantation, chemotherapy, and surgeries such as cesarean section become much more dangerous without effective antibiotics for the prevention and treatment of infection. World Health Organization response. Taking antibiotic resistance is a high priority for World Health Organization. A global action plan on antimicrobial resistance, including antibiotic resistance, was endorsed at the World Health Assembly in May 2015. The global action plan aims to ensure prevention and treatment on infectious disease with safe and effective medicine. The global action plan of antimicrobial resistance has 5 strategic objectives. First, to improve awareness and understanding of antimicrobial resistance. Second, to strengthen surveillance and research. Third, to reduce the incidence of infection. Fourth, to optimize the use of antimicrobial medicine. And 5, to ensure sustainable investment in countering antimicrobial resistance. So, it is very important to say, finally, the global antimicrobial resistance surveillance system, global antibiotic research and development partnership, interagency and coordination group of antimicrobial resistance. The United Nations Secretary General has established also IAGCG to improve coordination between information organization and to ensure effective global action against this threat in health security. So, in generally, all worldwide is in danger from this global antibiotic resistance and microbial. We start with the common people. All individuals, all patients can be more awareness, all doc can be more awareness before prescribe antibiotic in some case. It is all from me. I have a nice day. I wish you good health and take care about all this I speak about. Have a nice day.